Hello and welcome to the Victory Education Lounge. We're excited to present our quick guide on diabetes mellitus. Our aim is to help you understand the disease, offering insights and tips to managing diabetes to avoid nasty complications. Don't forget to hit that like button, subscribe to our channel for more insightful content, and leave a comment below to share your thoughts and experiences with this disease. We love hearing from you, and your engagement helps us create better content tailored to your interests. Did you know that nearly 500 million people worldwide are living with diabetes as we speak? Quite a startling statistic, isn't it? This is the reality of diabetes mellitus, a condition that is rapidly becoming a global health crisis. This surge is not just impacting individuals, but straining health systems worldwide. The urgency to address, understand, and manage this condition has never been more pressing. With such staggering numbers, understanding diabetes mellitus becomes not just important but essential. So, what exactly is diabetes mellitus? Well, think of it like a car. Just as a car needs fuel to run, our bodies need glucose, a type of sugar, for energy. This glucose comes from the food we eat, and insulin, a hormone produced by the pancreas, is the key that allows glucose to enter our cells to be used as fuel. Now, imagine if the car's fuel system malfunctions. It's the same with diabetes. In this condition, our bodies either don't produce enough insulin or can't use it effectively, resulting in high levels of glucose in the blood. Over time, this can lead to serious health problems. There are three main types of diabetes mellitus: type 1, type 2, and gestational diabetes. In type 1 diabetes, the body's immune system mistakenly attacks and destroys the insulin-producing cells in the pancreas. It's like losing the key to the car's fuel system. This type often develops in childhood or adolescence, but it can occur at any age. Type 2 diabetes, on the other hand, is akin to the car's fuel system becoming resistant to the key. The body either doesn't produce enough insulin or the cells become resistant to insulin's effects. This type is more common and usually occurs in adults, but it can also develop in children and adolescents. Lastly, gestational diabetes is a temporary condition that occurs during pregnancy, similar to a temporary glitch in the car's fuel system. It can affect both the mother and the baby, but typically resolves after giving birth. Despite their differences, all types of diabetes have one thing in common. They cause an increase in blood glucose levels, which can lead to a range of health issues if not managed properly. So understanding diabetes isn't just about knowing its types, but also about recognizing how it affects our bodies and how we can manage it. Knowing the types of diabetes helps us understand how they affect our bodies differently. Scene script. Can you prevent diabetes mellitus? The answer is yes, particularly for type 2 diabetes. Let's dive into the world of prevention. You see, prevention is not merely about dodging the bullet, it's about taking control of your life, your health, and your future. A robust prevention strategy encompasses lifestyle modifications. And no, you don't have to turn your world upside down. Small, consistent changes can lead to significant results. Start with your diet. A balanced diet is not just a cliché phrase, it's a powerful tool. Picture your plate. Half of it should be filled with colorful fruits and vegetables, a quarter with lean protein, and the remaining quarter with whole grains. And remember to hydrate. Water is your best friend. Make it a habit of reaching for a glass of water rather than a sugary drink. Next, let's talk about exercise. Regular physical activity is a cornerstone of diabetes prevention. It helps control your weight, uses up glucose as energy, and makes your cells more responsive to insulin. And when we say exercise, we don't mean running a marathon. Moderate intensity activities like brisk walking, cycling, or even dancing can do the trick. Strive for at least 30 minutes of exercise most days of the week. Weight control is another critical aspect. Maintaining a healthy weight can significantly reduce your risk of developing type 2 diabetes. It's not about achieving an unrealistic body image, but maintaining a weight that's healthy for your body type and height. Now, let's address those at risk. If you have a family history of diabetes or a personal history of gestational diabetes, you're at a higher risk. But don't let that scare you. Instead, let it motivate you to take action. Regular checkups, blood sugar monitoring, and consultation with healthcare professionals can help you stay ahead of the game. So what's the takeaway? It's simple. Prevention is in your hands. You have the power to shape your health destiny. It's about making conscious choices every day: what to eat, how to move, and how to live. Remember, small changes can have a big impact on your health. Scene script. Diabetes mellitus is not just about high blood sugar. It can lead to serious health complications, both short-term and long-term. Let's delve into the short-term complications first. Hypoglycemia, also known as low blood sugar, can happen if you take too much insulin, skip a meal, or exercise more than usual. Symptoms can range from shakiness, sweating and rapid heartbeat to confusion and even loss of consciousness in severe cases. On the flip side, there's hyperglycemia or high blood sugar, which can occur when the body doesn't have enough insulin or can't use it properly. If left untreated, it can cause a condition called diabetic ketoacidosis. This is when your body, unable to use glucose for energy, starts breaking down fats, creating a buildup of acids in the bloodstream known as ketones. This can lead to a diabetic coma if not addressed promptly. Now let's shift our focus to long-term complications. Over time, high blood sugar can damage your heart, leading to heart disease. It can cause blockages and hardening of the arteries, which can eventually lead to a heart attack or stroke. High blood sugar can also take a toll on your kidneys, leading to kidney damage or kidney disease. This is because excess sugar can overwork the kidneys as they filter your blood. Neuropathy, or nerve damage, is another long-term complication. This usually affects the nerves in the legs and feet, leading to numbness, pain, and loss of sensation. Then there's retinopathy, where high blood sugar damages the blood vessels in the retina, potentially leading to blindness. And let's not forget about foot problems. Diabetes can lead to poor blood flow and nerve damage in the feet, making wounds hard to heal and increasing the risk of infections and amputations. These complications paint a serious picture of why managing diabetes is so important. But remember, they're not inevitable. With the right precautions and care, you can prevent or delay them. Regular monitoring and medical checkups are key to preventing these complications. By staying vigilant and proactive, you can lead a healthy and fulfilling life even with diabetes. Living with diabetes is challenging, but with the right treatment and management, it is possible to lead a normal life. When it comes to managing diabetes, medications play a crucial role. Insulin therapy and oral medications are commonly prescribed to help regulate blood sugar levels. Insulin therapy is often used in type 1 diabetes, and sometimes in type 2, while oral medications are typically used for type 2 diabetes. However, taking medications alone isn't enough. Monitoring your blood sugar levels regularly is vital. This helps you and your healthcare provider understand how your body responds to your medication and lifestyle adjustments, and it aids in keeping your glucose levels within the target range set by your healthcare team. Speaking of healthcare teams, they play an integral role in your diabetes management. This team may include your primary care physician, a diabetes educator, a dietitian, a pharmacist, and even a mental health professional. They work together to provide you with personalized advice and strategies for managing your diabetes effectively. Now let's talk about daily routines. Regular blood sugar monitoring is a given, but what about your eating habits and physical activity? A balanced, nutritious diet and regular exercise can help manage your blood sugar levels and maintain a healthy weight, both of which are essential in managing diabetes. But there's more to diabetes management than just physical health. Living with a chronic condition like diabetes can take a toll on your emotional and mental health. It's important to seek support when needed, whether it's from a mental health professional, a support group, or your loved ones. Finally, regular medical appointments are key. These checkups allow your healthcare team to monitor your progress, adjust your treatment plan as needed, and catch any potential complications early. In conclusion, managing diabetes involves a comprehensive approach that includes medication, regular monitoring, a healthy lifestyle, mental health support, and regular checkups. Remember, your health is in your hands. Stay informed, stay vigilant, and stay healthy. So, we've taken a deep dive into diabetes mellitus today. We've learned that it's a condition that affects the way our bodies process glucose, with various types including type 1, type 2, and gestational diabetes. Each type has its unique characteristics, but all involve an imbalance in the body's insulin production or use. We've explored how lifestyle modifications such as maintaining a balanced diet, regular exercise, and a healthy weight can help prevent or delay type 2 diabetes. We've also discussed how those at risk, such as those with a family history or a history of gestational diabetes, can benefit from these preventative measures. We've examined the possible complications of diabetes, both short-term ones like hypoglycemia, hyperglycemia, and diabetic ketoacidosis, as well as long-term issues like heart disease, kidney damage, neuropathy, retinopathy, and foot problems. Regular monitoring and medical checkups are crucial to avoiding these complications. In terms of treatment, we've touched on medication options, the importance of blood sugar monitoring, and the role of healthcare professionals in managing this condition. We've underscored that daily management routines and emotional and mental health support are essential for those living with diabetes. Remember, this information is for educational purposes, and it's always best to consult healthcare professionals for personalized advice. With the right knowledge and management, it's entirely possible to lead a healthy and active life with diabetes. If you found this video helpful, don't forget to like, share, and subscribe for more informative content. Stay healthy, stay informed.